everybody. Dr. Rafich here from Vet Triage. I'm trying to record on a smaller frame here, so just bear with me while we adjust this. It's been a while since we recorded. Good to be back, and we are continuing on with this April 2021 edition of Veterinary Surgery. The paper we're talking about is a cadaver study in dogs. There you have it. Ex vivo comparison of different thoracoabdominal staple sizes for typhlectomy in canine cadavers. This study comes out of Auburn University, as well as a specialty hospital in Florida. Just to explain the title, thoracoabdominal. So first of all, ex vivo, meaning outside the body. Thoracoabdominal stapler sizes. So there's different types of staples that we use in abdominal surgery. Some are for gastrointestinal surgery, some are for thoracic surgery. There are some that are for both. So thoracoabdominal, usually we abbreviate as TA staplers. And then typhlectomy, TYPH is the Latin name for cecum, which is the equivalent of the appendix in people. But this is, of course, in dogs. And then ectomy is removal of. So this is cecal removal surgery. And then canine cadavers, of course, these are cadavers that they are doing the study on. The objective is to determine the influence of staple size on leakage pressure of typhlectomy sites in canine cadavers. This is a randomized experimental cadaver study, 24 cadavers. They performed it with a right paracostal laparotomy. So paracostal meaning that it's on the side of the rib cage to enter the abdominal cavity. Laparotomy is the incision into the abdominal cavity. They assigned the dogs into one of three groups, either the TA30V3 2.5 millimeter group. Those are all dimensions of staple sizes. So TA is thoracoabdominal, 30V3 2.5 millimeter. The other group is a TA 63.5 millimeter and then a TA 64.8 millimeter. Those numbers are more for surgical residents. They should know those for their surgery boards as far as what the difference is in the dimensions of the staples themselves for each of those sizes. Results found the mean body weights across the cadavers were 18.7 kilograms for the TA30V3 2.5 millimeter group, 16.2 kilogram sized dogs in the TA 63.5 millimeter group, and then 14.2 kilograms for the TA 64.8 millimeter group. The mean initial leak pressure across the groups was 182 millimeters of mercury. That for the TA30V3 2.5 millimeter group. It was 112 millimeters of mercury for the TA 63.5 millimeter group, and then 77 millimeters of mercury for the TA 64.8 millimeters group. So this is testing how much pressure it takes to get leakage for the surgical site basically to fail using each of those different stapling devices. Conclusion found that each stapler size that was evaluated resulted in a mean initial leak pressure in excess of typical intraluminal pressures under normal circumstances. There were no differences between the groups, so the clinical significance was any staple size will do. So the importance of this kind of study that they are testing the pressures beyond what the body normally would be able to accommodate. So you want to test super physiologic levels, even though it's not realistic. It at least tells you that that the staple devices can at least handle probably the normal body because they're testing these pressures in excess of what the normal body can handle. Introduction. The advantages of stapling equipment include reduction in surgical time, reduction in tissue trauma, preserving blood supply, reduction in the potential for contamination, consistency in application, maintenance of luminal diameter, improved security during the lag phase of intestinal wound healing. Cecal disease in dogs includes cancer, impaction, inversion, rupture, obstruction. Previous reports have reported the use of linear staplers, the effect of staple line offset, and suture augmentation or the use of suture oversew on a staple line leak pressure for the gastrointestinal surgery in dogs and cadaver. Another study looked at gastrointestinal anastomosis stapler, the GIA stapler, 3.8 millimeter size for typhlectomy in canine cadavers, comparing features of sutured, stapled closure alone, and stapled suture oversew with a Parker Kerr or a Cushing inverting pattern. That study found initial high leakage pressure with addition of the Cushing oversew. That means they use a stapler first, and then over the staple line, they use suture material using a specific pattern called the Cushing pattern. The cecum and large intestine contain a higher bacterial load than small intestine, and the impact of a suture over sew on typhlectomy site wound healing is not known. Both the GIA, which is the gastrointestinal anastomosis stapler, and the thoracoabdominal stapler, which is the TA, they're both designed for use in open surgery, and they're available with variable staple lengths. Commonly used TA sizes are the TA30 V3 2.5 millimeter, the TA60 3.5 millimeter, the TA60 4.8 millimeter, with compressed staple heights of 1 millimeter, 1.5 millimeter, and 2 millimeter respectively. The idea there is that you start off with a certain staple size, so 2.5 millimeter, and then when you apply the staple, it's of course going to compress. That's the whole point of using a staple. And when it compresses, there's a different size. The TA30 V3 delivers 3 staggered rows of staples, while the other 2 stapler devices deliver 2 staggered rows of staples. So staggered, of course, meaning that they are staggered. They're not parallel. They're not parallel to each other. They are staggered like this. All right. As far as materials and methods, the stapler sizes evaluated were the DST series TA30 V3 2.5 millimeter, the TA60 3.5 millimeter, and the TA60 4.8 millimeter. The TA stapler was applied across the base of the cecum as close to the colonic junction as possible and activated, compressing a tissue for 10 seconds before deploying the staples. Then they applied a 20 gauge needle attached to a fluid administration set. They injected sodium chloride as well as methylene blue. They attached a pressure transducer and a multi-parameter monitor. So this is the setup here. Cecum, staple device, fluid pump with a needle, the monitor needle so they can measure the pressure, and then of course you have to occlude both sides, the colonic side and the ileal side, in order to measure the pressures of the typhlectomy site. Results. The mean weight of the cadavers of the dogs was 16.2 kilograms. The mean weight of the dogs in each group for the TA30 V3 was 18.7 kilograms. The TA60 3.5 millimeter was 16.2 kilograms. The TA60 4.8 millimeter was 14.2 kilograms. The overall mean cecal base length was 12.2 millimeters, and then the length for each group for the TA30 V3 group was 12.5 millimeter. The TA60 3.5 millimeter group was 11.6 millimeter. The TA60 4.8 millimeter group was 12.7 millimeter. The mean overall cecal base thickness was 4.9 millimeters, and then when you compare it to each group, the TA30 V3 group was 6.8 millimeters. The TA60 3.5 millimeter group was 4.6 millimeter, and then the TA60 4.8 millimeter group was 4.5 millimeters. The mean initial leakage pressure was 181.5 millimeters of mercury. And then per group, the TA30 V3 group was 112 millimeters of mercury. The TA60 3.5 millimeter group was, it was 181.5 millimeters of mercury for the TA30 V3 group, and then 112 millimeters of mercury for the TA60 3.5 millimeter group, and then 77.2 millimeters of mercury for the TA60 4.8 millimeter group. Leakage was observed in 23 out of 24 samples occurring at the staple line. The specimens leaked an excess pressure of 26 millimeters of mercury. Discussion. The initial leakage pressure in the study exceeded physiologic parameters reported in canine small intestine, and the cecum is considered part of the large intestine. Studies in humans have reported colonic and anastomotic leakage rates ranging from 1.8 to 15.9%. Another study found overall dehiscence rate of 10% and a 17% mortality rate with full thickness large intestinal incisions in dogs. There's a dehiscence rate of 14% for small and large intestinal anastomosis papers for dogs. No difference seen in the incidence of leakage for hand suture versus staples, and stapling results in overall shorter duration of surgery. Therefore, you probably want to choose stapled approach if you have the preference. There's a significant reduction in dehiscence with stapled anastomosis compared to sutured with further supports using staples. A green TA staple height, which is the TA 64.8 millimeter, more closely approximates normal gastric and small intestinal mural thickness. Another study found the upper limit of small intestinal intraluminal pressure to be 25 millimeters of mercury. The mean initial leakage pressure from 3 stapler groups evaluated exceeded this value, and the large intestine is a comparatively lower pressure system. The GI-A stapler with a 3.8 millimeter cartridge has a compressed staple height of 1.5 millimeter, which is the same as the compressed staple height of the TA 63.5 millimeter cartridge. The initial leak pressure of the GI-A stapled closure group from another study was similar to the initial leakage pressure of the TA 63.5 millimeter group in the present study of 109.5 millimeter mercury versus the 112 millimeter mercury they found in this study. The most common location for leakage was at the staple line. These pressures exceed physiologic pressures. The TA30V3 group produced a mean initial leakage pressure of 181.5 millimeters of mercury. However, the mean initial leakage pressure of the TA 63.5 millimeter and the TA 64.8 millimeter were above 25 millimeters of mercury. Interestingly, the mean cecal thickness across groups was 4.9 millimeters. Possible complications: you could have an incomplete staple contact with the anvil that could occur. You can have a deformed staple leg due to excessive expansion pressure of the tissue encompassed by the leg could occur. The elastic properties of tissue probably further contributes to the compression and staple line security. And so they mentioned a bunch of issues with the paper. My concerns, of course, is that we don't know how this would affect the dogs that have diseases of the cecum, because if you're doing a typhlectomy, you're probably performing it because there's a problem with the cecum. And this is, of course, a low number of dogs, although 24 is not horrible, but you like to have more. So for pet owners who are watching this video, the important thing here is if you're chasing a surgeon for a typhlectomy, you can inquire about using staple devices and have them explain to you why they make a decision using suture versus staple. And then for the veterinarians, for those who perform this surgery, try and dive into the stapling world. You can practice on cadavers in your practice, and knowing that it has all these benefits to it. And now there's a study, at least one study, showing this. It's worth probably going through the learning curve so you can have better outcomes and more secure surgery for your typhlectomies. All right, guys, we'll see you guys in the next video. Take care.